One of the worst and most scary things for breastfeeding and pumping moms is you wake up one day and you start to feel a tender, painful, hard lump in the breast. You're told to massage it out, but it's only making it worse. There's a lot of outdated advice out there about mastitis and plugged ducts. My name is Annie Abbasi. I'm an occupational therapist and lactation consultant. And today I'm going to talk about what's actually happening with the breast tissue, what helps, and what's actually making it worse. So first we need to reframe the language. I don't love the term plugged duct anymore because now it's thought as more of the mastitis spectrum. It's all inflammation from plug duct to mastitis. It's kind of the same issue. It just progresses to have worse symptoms over time. So when you think of a plugged duct, you think of an actual clog in your ducts, and that's not what's actually happening. There is no clog. It's more of the ducts are narrowing from the inflammation surrounding the tissue. So if you think of your breast ducts as more like highway systems where there's multiple directions, there's multiple exits, it's not a one-way road. There are multiple ways for the milk to get around, so it's really impossible for it to actually clog and plug like the name suggests. And this is kind of a new thought. It was thought that that was the issue, but with updated imaging and more research on it, we're finding that it's actually inflammation of the surrounding tissue that is what's causing that harder, more painful lump. So if we think of it more as inflammation and a spectrum, we know better how to address it. We're addressing inflammation. We're not addressing a plug. So what mastitis can feel like are tender, firm area, redness, and swollen breast tissue. These are local symptoms where it can also progress to systemic systems, meaning you're starting to have the fever, the chills, the flu-like symptoms, and that's a sign to maybe reach out for a provider for extra assessment and maybe some medications if necessary. So the guidelines for addressing plague ducts and mastitis actually changed in 2022, but we're still hearing a lot of outdated advice on how to address it. So here are things that we're not going to do anymore when you start feeling the tender, hard redness of the breast, okay? We're not going to dig it out. We're going to avoid aggressive massage because, again, you're not digging anything out. It is inflammation. And if you dig and massage inflammation, you're only going to make it worse. We're not going to go to the pump and try to empty out the breast. And also, this goes along with a partner or someone trying to, quote, suck the plug out. That's just not what's happening, and that's not going to do anything. And in fact, more aggravation on the breast is probably, again, going to make it worse. And then you're also introducing like other bacteria to the area as well. The use of heat is also outdated. It's actually ice now, but we'll go over what to do later. And then any sort of like change in position is really not going to help it either. So you don't have to get out on all fours to feed your baby or pump. That's just not necessary. These types of things actually make it worse because we're increasing inflammation. We're going to worsen the swelling and pain, and you can actually push yourself further along and towards more severe symptoms. So here's what are the guidelines now, updated guidelines. We are treating inflammation. And if you want to think of it like any injury on any body part, like a sprained neck or swollen ankle, what would you do in that situation? Would you apply heat? Would you massage it? No. So that's not what we're going to do to an injured breast either. What we're going to do is we're going to use cold packs between feeds, NSAIDs as directed by your provider to reduce swelling and pain. We're going to do gentle lymphatic massage. This is different than the digging hard massage. It's light, it's like petting a cat, and there's a specific direction that you want it to flow. And I have made another YouTube video to show you how to do that as well. So go ahead and check that out when we're done here. We're going to continue to feed on demand and not feed any more than we need to. This promotes some breast rest without interfering with supply or your baby's needs. So we're feeding just as much as we normally would, either with baby at breast or with the pump. We're going to go back to the latch and positioning basics and make sure everything looks solid there as well. And then we're going to support your body with any injury, rest, hydration, nutrition as usual. And then additionally, if you can find a provider that does this, like a physical therapist in California or in other states, occupational therapists can do it too. But ultrasound is an evidence-based strategy to reduce the inflammation as well. So if you wake up and you feel the symptoms and signs of a plugged duct or mastitis coming on, try these conservative measures first. Here is when you seek extra help or a provider for further assessment. If your fever is over 100, if your symptoms are worsening after 24 to 48 hours despite your conservative measures, or increasing just pain, redness, or whatever systemic illness you're facing. If it's getting much worse, you need to seek out medical care. Sometimes the mastitis is bacterial and will require antibiotics, and that's okay. So let's talk about reoccurrence and avoiding the reoccurrence. So we're going to avoid unnecessary pumping or oversupply. And if you have an oversupply, that automatically puts you at increased risk for the plug ducts and mastitis. We're going to address latch issues, your pump fit, the feeding patterns, and then when it's time to wean, or you and your baby are ready to wean, we're going to do gentle weaning strategies and not cut off cold turkey. If we cut off cold turkey, that will also put you at risk for mastitis or plug ducts. If you're having reoccurring mastitis or plug ducts despite all of these interventions, it can be a sign of a bigger issue as far as what's called breast dysbiosis, which is kind of the microbiome of your breast that can be a little off and contributing to the reoccurrence. So that would be another time to get assessed by a medical provider if you are having these all the time with no relief and none of these conservative strategies are helping you. Another thing you want to do is reach out to an IBCLC, a lactation consultant, because sometimes when we're having recurrent mastitis or plugged ducts, there could be something that we're doing as far as feeding or pumping that's contributing to this. So it's important to get a full assessment of what's going on so the root cause can be addressed, and hopefully we can avoid this in the future. If you have had it before, you know plugged ducts and mastitis are no fun and very uncomfortable. If you haven't, we want to avoid that situation. So seeking out lactation care sooner rather than later is very important. So to recap, the mastitis plug ducts guidelines have changed in the last few years. There is still a lot of outdated advice out there, but what we're going to do is ice, lymphatic massage. Go visit my next video about how to do that. NSAIDs, breast rest. We're not over pumping. We're not overfeeding. We're just feeding as usual. You do not have to get in any crazy positions. You are not trying to get a plug out. You are addressing the inflammation. What we're not doing is heat, hard massage, and over pumping to try to get a plug out. We are not getting a plug out. It is inflammation. I cannot stress that enough. But if you can understand that you are addressing inflammation, I think there's a better understanding of why the recommendations are the way they are. And remember, if your symptoms are worsening over 24 to 48 hours, that's when you want to seek extra help if you have a high fever or any sort of concerning systemic issues.